Now we move to the medial surface. So as we said, the medial surface, you could examine it using a sagittal cut, medial sagittal cut, or you could use also high axial cut. So your first mission is to identify the corpus callosum, and then you identify the sulcus, which is called
Cingulate.
cingulate sulcus. Very good. Cingulate sulcus has two branches. This one posteriorly is called marginal, and this one, it is the same name as this area.
Paracentral.
Paracentral. So this is paracentral branch. This is paracentral lobule. Okay. And now, so anterior to the paracentral lobule is medial surface of frontal. Just anterior to the paracentral lobule is the
supplementary motor area on the medial surface.
exactly. And more anteriorly is all the rest of the medial frontal surface, medial F1. And then you have the Y shape, parieto-occipital sulcus, calcarine sulcus. You have the cuneus, and you have the lingual gyrus. And here you have the precuneus.
Yeah.
It's separated inferiorly by a small sulcus, separating it from the limbic loop. This one is called subparietal sulcus. This one in red, subparietal sulcus, below the parietal. So you start identification by identifying first the corpus callosum and the cingulate sulcus. You could identify directly the paracentral lobule. Sometimes it's very, you could identify the shape directly, or you could look for the Y shape posteriorly. So this is how you start your identification. On the medial surface, the central lobe of the brain, you see it's a little bit oblique, like this. So here is the precentral gyrus, postcentral gyrus. Anteriorly, you have this horizontal sulcus, anterior-posterior sulcus, which is called
the superior frontal
exactly
sulcus.
superior frontal sulcus, and it from behind the postcentral sulcus. It meets this sulcus from behind, which is the intraparietal, as we said before.
Intraparietal, yeah.
Okay. So see here. So here is the central lobe of the brain. Central lobe. So the central lobe we have here. This is the
pre-central sulcus.
this one.
The central.
Central, and this one.
Yeah. The post-central.
Post-central. And here is this gyrus, which is called
Pre-central gyrus.
and this one.
Post-central gyrus.
So this is anatomy of the lateral surface of the brain. But actually, on axial cut, you can see the lateral surface of the brain. You can see also the medial surface of the brain. So you see here,
yeah,
the medial surface of the brain. Here you have the paracentral lobule. So precentral gyrus here, postcentral gyrus here. They meet here in the midline at the medial surface of the brain as the paracentral lobule. The paracentral lobule is limited behind by this branch, which is called
The marginal branch.
marginal
branch, and anteriorly by this branch, which is
Central.
paracentral branch. Okay?
Yeah.
Okay. So more anteriorly on the frontal lobe, we have this sulcus, which is called
the superior. Sorry. The is it the superior or middle frontal sulcus?
no, you cannot see the middle here. The middle
Yeah,
is
yeah. It's superior. Yeah, it's just parallel to the other one. Yeah.
So here is the superior frontal sulcus. So this gyrus is
The frontal gyrus.
Frontal.
Yeah.
frontal gyrus. Which one?
Superior.
Superior frontal gyrus.
Yes, and the lateral to the superior frontal sulcus is this gyrus, which is
Middle.
middle frontal gyrus. Very good. Now,
Yeah.
the medial surface, you will see the
Supplementary motor area.
supplementary motor. So you are here. This is supplementary motor area. Very good. On the medial surface. So you see anatomy on the lateral surface, F1, F2, and you see on the medial surface, SMA. Here you see on the lateral surface, precentral and postcentral. Here you see on the medial surface, the paracentral lobule. On the parietal lobe, here you see this sulcus, which is intraparietal.
Mhm.
So intraparietal divides into superior parietal lobule medially, above, inferior parietal lobule below.
Yeah.
On the line, medial surface, we have the precuneus. You see?
Yep.
It's very beautiful anatomy. Because this cut, it shows you medial surface and lateral surface on the same time.
Mhm.
Okay. So, and actually these three areas, SMA, paracentral lobule, precuneus, when you study the bone, you will see actually that all these three areas lie below the parietal bone, meaning they are all related to the sagittal suture.
Nice.
We will study this next week, inshallah. So SMA anteriorly, PCL in the middle of the sagittal suture, and the posterior part of the sagittal suture, we have the precuneus. So all is related.
Mhm.
So now you start identifying anatomy. You could start by identifying the central sulcus itself. You could identify this sign. What is the name of this sign?
Omega sign.
Omega sign. Very good. You could start by saying, okay, now I can identify a vertical sulcus intersecting with a horizontal sulcus coming from anterior. So this is the intersection of the superior frontal with the precentral. Or you
Mhm.
could say, okay, I'm coming from behind. I see a vertical sulcus intersecting with a horizontal sulcus coming from behind. So this is the intersection between the postcentral and the intraparietal. Or you could see, I will identify this point, the end of the pars of the marginal branch.
Marginal.
Exactly.
yeah.
It's called, so marginal branch, right and left, it will have a sign like this, like what we call pars bracket.
Yeah.
Like between brackets.
Bracket sign.
Yes, so bracket sign here. So the bracket sign is the end of the marginal branch of the cingulate sulcus. When you find this, you know that the sulcus just anterior to it is the central sulcus. So the one just anterior is central.
Mhm.